This is episode 44 of the Women in Depth podcast. The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome back to Women in Depth. I'm your host, Lourdes Fiato. I am super excited about today's guest and topic. Dr. Kaeni, or Dr. Kat, is a psychologist who specializes in maternal mental health. And today she will be talking about what maternal mental health is, what are the maternal mental health disorders, why this is important, who is at risk for experiencing maternal mental health disorders, and what can be done to support moms so that they are less likely to experience these difficulties, and how to support them if they are struggling. Dr. Kaeni, or Dr. Kat, is a psychologist specializing in maternal mental health. She has a private practice in Claremont, California, and runs a free pregnancy and postpartum stress support group in her community. Dr. Kat is also the creator and host of the Mom in Mind podcast, which focuses on maternal mental health and wellness. Podcast topics range from preconception through pregnancy and postpartum. She interviews women and men who have gone from struggling to wellness, as well as the advocates, experts, and healthcare providers that work to help moms and families recover and thrive. Dr. Kat volunteers with Postpartum Support International as the area co-coordinator for San Bernardino County and works with San Bernardino County and their maternal mental health work group to offer training to local mental health and allied healthcare providers. Dr. Kat's mission is to support mothers and families, train healthcare providers, advocate for women and families, and bring discussions of maternal mental health out into the open. Hi, Dr. Kat, and welcome to the podcast.
Thank you so much, Lourdes. I'm happy to be here.
I am very excited about this conversation because it is something I can relate to personally. I have seen this happening in the lives of many of my clients, and I see it among my friends and family. And so I know as a woman, as a mom, as a family member, as a therapist, that the issues around maternal mental health are very, very real.
Yeah.
And so thank you for coming onto the podcast today to talk about this really important topic. I was wondering if you could start by sharing how you were drawn into this area.
Yeah, absolutely. And thank you for having me on and highlighting this subject with your listeners. It's really, really important and important to me personally, as my personal story is that I was already a therapist working in the field, and then I got pregnant with my first child about 7 years ago. And the pregnancy was fine. Everything went well. There were really no complications. Birth was very long, but
I can relate to that.
She got right. Yeah. But she came out eventually, and then looking back on it now, I think my first signs of anxiety were the day that she was born. But it took me quite a long time to realize that I was dealing with depression and anxiety and OCD after my daughter was born. It probably took me almost a year to fully realize what was going on. And I had lots of stuff that would have and should have pointed me, as a therapist, should have pointed me in the direction of understanding that something's not right, and I should probably get help. That would have been the therapist part of me that would have understood that. But the mother part of me didn't know that I wasn't supposed to feel that way. Didn't know that suffering wasn't part of the deal. There were some parts of me that did feel like something's not right. This is unbearable. But the side of I wasn't integrated. I wasn't, my ideas of motherhood and how I was supposed to feel and what it was supposed to be like were so different from how I actually felt. And therefore, I just ended up feeling like ashamed and guilty and bad for feeling bad. And that went on for some time. I had symptoms of anxiety. It was very hard for me to sit down and rest. I was constantly working on the list of things to do. I felt sad and depressed and would cry. My particular kind of depression also came with a lot of feelings of rage and anger that came out of nowhere. It was nothing I had experienced before. And I had a lot of intrusive thoughts, anxiety-based thoughts that would just pop into my head, that something bad would happen to my daughter, that I would do something bad to my daughter, or somebody else would. And this was just an ongoing process for quite some time.
Wow.
Yeah. And then I figured out what was going on. I can't even remember exactly how I figured it out, but then I started reading and looking more into it. And then I just got really angry. I was really mad that nobody had told me about this. And I'm a therapist. I'm supposed to help people who are feeling like this, and I don't even know what's going on. And so that kind of anger and then newly found passion really propelled me into the field of maternal mental health, because my mission is to try and make sure that nobody feels like that.
And the interesting thing about your experience is it's so common. I mean, I'm listening to you and I hear myself in many parts of your experience. And I think part of it too is just, even if you are feeling badly, whether you're, exhausted, you're anxious, you're depressed, even with our training, I'm recognizing that these symptoms fall into certain categories. When you're in it as a mom, that kind of falls to the side, and then it becomes okay. I'm just feeling this way because this is just part of the process, and so this, this is not. There's nothing abnormal about how I'm feeling, and I just have to, kind of push through this. Or the other part of it is, I need to snap out of it because I should be grateful because my baby's healthy, and why am I being so weak? Like women do this all the time. They have babies. What's wrong with me that it's so hard for me? Yeah. And then, like you said, some of the, I thought it was very beautiful and brave of you to mention, even those thoughts of hurting, your child. We have thoughts like that and we can't say them to anyone. And then we are ashamed that we had that thought. Like, what does that mean about me? Yeah.
Yeah. All of that. Yes.
Yeah.
You're absolutely right. It's way more common than we know and that we acknowledge on some level. And because of that adds to those feelings of guilt and shame, that if it were something like that everybody knows about, such as cancer or something, we don't make people feel bad when they have cancer.
Right.
But moms get treated in a very special way when they don't feel all of those societal ideals of what motherhood is supposed to be like. And then we do the same thing to ourselves.
Right. So maybe we can shift gears now and start with, just for those who maybe aren't familiar with what maternal mental health is all about, can you maybe share what that means and some of the basic facts around it?
Sure. So maternal mental health kind of encompasses mental wellness during anywhere from conception to pregnancy to birth and postpartum, and any number of things that can happen during that time that can affect your wellness, your emotional state, your ability to cope, anything along those lines. I'll start first with kind of some statistics. Okay. About 80% of women will experience the baby blues. And that's commonly what people confuse postpartum depression with, is the baby blues. Baby blues is a really, as I said, common experience. It's like about 2 weeks after birth. For about a period of 2 weeks after birth, my mom may be tearful or overwhelmed or have mood shifts, what you would associate with potentially like a really bad PMS type of type of thing. She can still cope through it. She still has moments where she's okay sometimes, but with good rest and nutrition and support, she typically will come out of that and recover and kind of start to get back to her feeling a little bit more like herself. But for about 20% of women, that feeling in the first 2 weeks is either very intense or lasts longer than 2 weeks. And if it's lasting longer than 2-3 weeks at the most, then we're looking at maybe a perinatal mood or anxiety disorder. So that would include depression, anxiety, PTSD for some people who've had trauma, OCD, obsessive compulsive disorder, panic. And for some people, a little more rarely, is a bipolar disorder onset or psychosis. Psychosis is the most severe form of postpartum illness.
Wow, that's really quite a range of how this can be experienced,
Yeah. Yeah, a lot of different things can happen. Depression and anxiety are a little more common. And then OCD as a formal diagnosis is sort of after that. But people can have symptoms that cross over into each of these things. Like you can have intrusive types of obsessive thoughts that would come with like an OCD type of a diagnosis, but it's not necessarily OCD. It could, I think the statistics are somewhere around 80-85% of people experience intrusive thoughts. Those are like thoughts that flash in your mind. They can be strange or scary or worrisome. You're not sure where they came from or why they are there. But it's a common experience for both mothers and fathers after birth.
And so when you said the 20%, you were referring the 20% of women who experience the perinatal mood or anxiety disorders that continue beyond 2 to 3 weeks. Is that 20% of women who give birth or 20% of the women experiencing the baby blues?
So baby blues is about 80% of women,
okay.
And that will resolve after about 2 weeks. 20% is for all women, and that can include loss. That can include pregnancy loss as well. So we often forget about the women who've experienced a loss, that they're still dealing with hormonal changes and emotional changes as well. And so they're still in the postpartum period also.
And I'm also glad that you mentioned birth trauma. I had another guest on the podcast last year who spoke, Krista Dancy, who spoke about birth trauma and really how that is a risk factor for, all of these disorders that you're describing.
Yeah. Yeah, unfortunately, it happens for sometimes for reasons that are medically based, or sometimes things that just happen, and people can feel traumatized by their experience.
Now, I don't know if you're able to speak on this, but if you are, would you be able to share some examples specifically of what birth trauma can look like? So for our listeners who hear that but aren't sure what that might be.
Sure. So there's a range, and just like everything I'm talking about today, it's on a spectrum. So there can be kind of mild to moderate to severe experiences or symptoms. For instance, I'll give you kind of two different ends of the spectrum. So somebody who is experiencing a more severe birth trauma is, I'm trying to think of a way to say it so I'm not giving away their information, but like a woman who has given birth, but then has a postpartum hemorrhage.
Okay.
And they're then in an emergency situation, and potentially a life-threatening situation where they're, bleeding profusely sometimes, and doctors are trying to stop the bleeding at any cost. At that point, a woman has just given birth. So her baby, in some cases, I'm thinking of two different cases, the baby is fine, and the baby is cared for by somebody else, but mom can't attend to the baby at all. She's having her very own experience and is disconnected. There are situations where the baby is not well, and baby and partner have gone to another room, and baby is being attended to. So now both mom and baby are in life-threatening situations. So that's an example of a more intense and severe trauma where the condition is life-threatening. there are situations where that of trauma where we might not on the outside see it as a traumatic experience. There wasn't necessarily like a life or death type of a situation, but where a mom feels out of control. For instance, if she went in with a birth plan of wanting to have a vaginal birth, and for whatever reason, no severe medical complications, maybe a long labor or something like that, a doctor came in and decided she should have a C-section, but baby comes out fine and healthy. That can still be a traumatic experience for that mom if she wasn't consulted. Her power has been taken away, her options have been taken away, and although she's healthy and fine, and the baby is healthy and fine, it still is sitting with her as a trauma.
Yeah, that makes a lot of sense, and thank you for giving those different examples. Again, like you said, it's on a spectrum. But I think those examples make the words birth trauma more, it's easier for listeners to identify what that could mean or how that's experienced.
Yeah.
So what makes women vulnerable to experiencing or developing perinatal mood or anxiety disorders beyond having perhaps a traumatic birth experience or a perception of a traumatic birth experience?
Yeah, I think this is a great question and very important for people to understand if they're at risk or not. And I'll say that sometimes people who don't have risk factors still do develop, but I'll come back to that. So are the most common and typical risk factors are if you yourself have a history of depression or anxiety, again, on any level of the spectrum, even if it was mild, but it was sort of diagnosable, that is a risk factor. If you have any history of perinatal mood or anxiety disorder yourself, like if you had a previous pregnancy and maybe you're just now finding out that you had a pregnancy or postpartum depression or anxiety, you're at a slightly higher risk for developing it again. If your family members have any history of perinatal mood or anxiety disorders or depression or anxiety, there are some genetic components here that are just like any other illness that put you at a slightly higher risk for that. Some other things that are good to note is that if you have a history of difficult PMS or hormonal changes at any given point, like if you have PMS or PMDD, premenstrual dysphoric disorder, you are at a higher risk of a higher susceptibility to mood changes when you're having hormonal changes. And pregnancy and postpartum are the biggest hormonal changes you'll ever have outside of maybe menopause.
Wow.
Yeah. So for people who are listening and you have a difficult PMS, there may be something there to attend to and prepare for if you're looking to have a birth.
So what can happen when a mother's mental health is not attended to when a mother's mental health is not attended to or she herself is unaware of what is happening? What are some of the consequences of this?
Right. There can be quite a few. What I hear most often is, and the experience that most moms describe is that it's sort of that something's wrong with them, or that they feel like a bad mother, or similar to what we were discussing before, that feeling that I'm not doing it right, I'm not good enough, I should be able to do these things and take care of my child, I should be happy. So a lot of really internal negative self-talk, blame, shame, guilt, those things are huge and prevalent, and most moms describe having those feelings if they're dealing with depression or anxiety or any number of those perinatal mood or anxiety disorders. It's one of those things where when our expectations about how things are going to go bumps up against the reality of our experience, it's just so disorienting. We just don't feel like how we think we're supposed to feel, and that can be really upsetting for people, in part because there are so many factors involved in this. It's not just that you are pregnant and you have a baby and you become depressed or anxious. There are hormones that are doing massive shifts. You have a certain number of hormones in your body that you need to be there in order to maintain a pregnancy. And then when you give birth, those hormones drop off because you don't need them anymore. And then you get another set of hormones that kick in for nursing and breastfeeding. So there are these shifts happening. Then on top of that, there's sleep deprivation, which is a problem across the board. So the sleep deprivation alone, if nothing else were happening, the sleep deprivation alone would make you feel horrible. But because we're not given this kind of information, things to look out for, that yes, your hormones are going to be changing. You might feel moody. You're going to be sleep deprived, and it's going to change how you think. We end up just it becomes internalized that there's something wrong with us. The experience we're having is because of something we've done wrong, or we are not good enough. And that's just what's happening in our own kind of minds with all of this, let alone whatever everybody else is telling you.
Yeah. And I'm just thinking too about, I guess this is almost like a segue to my next question, which is, looking at, what is in the shadow of all of this, what are some of the taboos about this topic? And earlier, when we were talking, you had mentioned that this is not an area that's really talked about. And when you're talking about, the mother's expectation versus the reality that's happening, there's also cultural, familial, societal expectations that are also coming in at the mother on all sides. So
yeah,
if you could speak to some of the myths or the taboo aspects of this that can actually contribute to the problem or get in the way of preventing it.
Oh yeah. And you're absolutely right. A lot of these things can be culture based. For instance, like in the US, what most of us hear as mothers in the US, that you're going to love motherhood. It's going to feel natural to you. This baby is going to come and you're going to know what to do.
I'm sorry.
I love your response.
Actually, I actually started laughing, but I held back when you said that it's going to feel natural, and right. Then when you said you're going to know what to do, I just couldn't. I'm like, oh, okay.
And that is so real. I love and appreciate your response. Right. And that's what we should be doing, is laughing at that. Right. But those are the messages that get into us that other people believe too, that this is what your body is meant to do. Women have done this for millennia before you. It's the most natural thing. People do it every day. So the underlying message is you need to be happy. You cannot complain if you're not. This should feel good and natural to you. And if it doesn't, there's something wrong with you. And any number of other types of associations we have with those messages. It's a setup. It's entirely unfair.
And I think, even those who are the healthcare providers, other women, other moms, they're well-intentioned. I know that their intention's not to be hurtful in any way. However, I think there are many places on a woman's post-birth journey where that happens, where there's this pressure to breastfeeding is natural. You'll know what to do. You need to breastfeed. Right. Mother's milk is best. And so this, for the mother who's struggling with that, all the messages she's getting about that, and why isn't my body working and I'm supposed to know how to do this. And so I think that also even isolates the mom even more because she can't talk about it because everyone says this is natural. And yeah.
Yeah. I mean, I find that this period of pregnancy, postpartum, any time during like the reproductive phase is one of the most intrusive periods of time in a woman's life. In terms of the amount of advice that people give you, things they think you should be doing and not doing, people touching you without permission, certainly when you're pregnant.
Yes.
Right?
Yeah.
We would not walk up and touch somebody's belly on the street. They would like punch you. You just wouldn't do it.
Yeah.
But for some reason with pregnant women, people feel like they can. It's bizarre. So you're getting all of these messages just from people around you, family members. Then you're hearing about horror stories, horrible things that happen to other people that is actually not at all helpful. when it's been given in this like, oh yeah, my aunt told me this one time this horrible thing happened. Like, how is that helpful to a mom who's anxious or worried? I don't know. And that's what I mean by intrusiveness. People are just giving their opinions and touching and all of these other things that just don't happen in that way at other periods of time.
And so this is a good place to shift into what are some ways to, I guess, to support moms in this process, or for a mom herself, what are some ways to, to support yourself, what are some things that are protective in nature that you can possibly put into place?
Sure. Like thinking about for yourself, if you're going into pregnancy or postpartum, it may be hard to think about, but do you have any of those risk factors that we talked about? What's the kind of lay of the land for you biologically, physiologically, going into this experience? Yes, of course, we want to think that this is supposed to happen and it's going to be awesome. But if you already know, for instance, if you know that you have a medical condition and you're going into pregnancy, you're taking different precautions. And so we need to be thinking about things in terms of mental health in the same way. What are your risk factors? Do you have a history of depression, anxiety, or bad PMS, so that you can think about self-care in a different way? There are, of course, things that are out there already, like birthing classes and nursing support classes, but those are all typically technical and focused on just getting the baby out type of stuff. Yeah, so being intentional about your process during pregnancy. Are there things that you can put in place that are supportive? If you know that you've had depression in the past, maybe now it's a good time to find a therapist that you like so that you can have support during the process. Ideally, if you can find a therapist who's trained in maternal mental health, that would be great. If therapy is not your thing, maybe another supportive practice that you know that helps you when you're not feeling well. It can be a mentor, or it can be a yoga practice, or it can be something that helps you feel connected and grounded, and that you are taking care of your body and your mind. There's a lot of people that talk about birth plans, and that's great. Birth plans also need some amount of flexibility because things don't go as we plan sometimes. So having a birth plan that allows for other types of support or other change that could be there. I know for a fact that having a doula as a support helps pregnancy and the birth process and postpartum process. So for those of you who don't know what a doula is, it's basically a birth support person who's trained to help you through pregnancy and delivery, and can also be an advocate for you in the hospital environment. And some doulas are also postpartum support people, and they can come and help, take care of any number of things. So having a designated support person, sometimes having to set different boundaries with family members can be really helpful. If you have a family member who comes over and needs to be taken care of, and you're not really in a place to be taking care of them, then either limiting contact or arranging for somebody else to be there to help you, like negotiating those types of relationships in a different way can be supportive. And also having a postpartum plan, not just a plan to get the baby out, but a plan to take care of yourself and the things that you might need afterwards. That ideally would include sleep, nutrition, and whatever is useful for you in terms of relaxation and mental health support.
That makes so much sense as I'm listening to you, that I know someone who, when she had her baby, she actually told everyone, friends and family, she didn't want to see anyone or have anyone come over for the first month. And, for some that can be perceived as, wow, she doesn't want us to see the baby, or any number of ways. But really, that was a very healthy boundary to put around herself and her family, because that's what she needed during that time. And, or other moms who, if you're going to come over, you need to come over at this time, and I can't be, a host, you'll need to come over and just be there, or asking people to come over so she can sleep, or come over with some prepared meals.
Yeah.
Yeah.
And unfortunately, again, in this culture, we don't have a practice for support. Some other cultures have very specific plans postpartum where for 40 days, the mom doesn't do anything but bond with her baby and feed her child. Everybody else takes care of everything else.
Oh my
I don't know how to
gosh.
get that here, but we need it.
Oh, wow. Yeah.
Yeah. So here, I mean, the narrative is a little bit different, that because of multiple things, that if you can take off time and be off and be with your child, great. In some places, they have to be back to work in 6 weeks.
Well, I think that everything you shared right now of, what can be done about this is just an important conversation to have with a mom before she has the baby. Even just talking to her about, risk factors and what could happen, and what are some things to consider having in place before and after. Because again, this is not part of like the birth plan or the baby shower or any of those things. And it's so important. It's so necessary, to have this dialogue.
It really is. Unfortunately, I think that the mom, the person who's carrying the child, on some level gets lost in a lot of this. And while yes, the care for the child is important and the pregnancy is important, but if mom is suffering, that's also not good for the child or anybody else. So, and we can't also then put the whole job on the mom to then, well, you're not feeling well, so it's also up to you to fix everything to get better.
Yeah.
That's not fair. It has to be a family effort to support mom, one, so that she doesn't get worse or feel worse. And two, it's a family system that needs to be attended to be supportive of everyone so that everyone can be well.
For family members and friends, loved ones of a mom who is, who is in this process of either about to give birth or has given birth, or it's out, afterwards, what are some things for them to be on the lookout for that would be like red flags that she needs some support beyond what is, maybe some more serious intervention, like, getting her into therapy or other things like that?
Mm-hmm. Yeah, for pregnancy and postpartum, it can be different. But certainly if she's saying things like, I don't quite feel like myself, or some moms won't admit it, but if they're not feeling connected to their pregnancy or to their baby postpartum, certainly if they're behaving in ways that seems like it's hard for them to hold their child or attend to them, those are some of the more severe kind of concerns, severe symptoms if they don't want to hold their child. If there's some covert ones, like if you walk into a brand new mom's house and everything is perfectly clean, that might seem like, wow, amazing. She has the energy to do this. And maybe she does, but also it's slightly unusual to have that much energy. So I would be worried about anxiety at that point. If she can't rest when she has time to rest, like if she needs to be up and moving all of the time, or if you as the partner or husband are saying like, hey, babe, why don't you rest? It's time to sit down. And she's like, oh, I'm fine. I'm just going to clean this over here. Something's going on that's, potentially something's going on that's keeping her up and trying to cope with how she feels. That one's a little bit harder because, if you're seeing somebody who looks like they have it together, maybe they do and maybe they don't. But certainly for moms who are their energy is very low. And most moms are tired because of some amount of sleep deprivation. But if it's like an exhaustion, they cannot. It's hard to motivate. It's hard to get up. Those are things that you can look out for. Certainly, if you notice anything that is like she's saying that she doesn't feel like herself, she doesn't know what's going on, that's something to be attended to. Most often what I hear is people say like, oh, you'll just get some sleep and you'll be fine, or just go on a walk, or just do these little things. And sometimes those little things help. But if you're hearing that more than a couple of times, then maybe it's time to look into some other types of support for her.
It's interesting because all the things that you're describing, as far as maybe some things to be on the lookout for, and to try to see if it's what you think it appears,
Mm-hmm.
You can see also how sneaky it is because,
Mm-hmm.
If she just says, I'm not tired, I'm okay with doing this. And,
Mm-hmm.
or, the house is clean, you just,
Mm-hmm.
it's, some of these things are so they're hard to identify.
Right.
Yeah.
And I don't mean to pathologize a clean house, but hey, I have 2 kids that are 4 and 7, and my house isn't clean all the time. But it is something to pay attention to. If, everybody tells moms sleep when the baby sleeps, which is actually very hard to do.
Yeah.
It's not the best advice, but if at night when it is time for downtime and sleeping and she still can't, then really that's a sign that she needs some sleep support.
Yeah. And I wanted to go back to this. We had mentioned it earlier, and I think I got so excited about something that I changed the conversation direction. I had asked earlier about what are some of the consequences of not paying attention to some of these maternal mental health issues. And I was wondering if you could speak to what some of the research out there has shown about long-term, if this isn't addressed with a mom. Because I don't remember exactly, but I remember when I spoke with Krista Dancy, she had talked about how this post-birth period, if it doesn't go well, it having ramifications for the mom and the child and their relationship, for years down the road. So it's not, it's really something that is far bigger than the immediate moment.
Absolutely, it is. So this is one of those areas where I try to tread lightly because because moms feel so easily blamed for things. I don't want them to feel blamed for this. Part of our concern really, and why we need to pay close attention, is that if there's a mom who's very depressed or very anxious, the interactions that she's having with her child will be reflective of that. So if a mom is feeling depressed and disengaged, does not want to hold her child, or is particularly, like I mentioned before, having those rage feelings, anger feelings, their connection, they may not have a very strong connection. So the process that the mom goes through is with bonding with her child, and the process that the child goes through is with attaching with her or the parent. So if there is a mom who does not feel connected and does not feel bonded, then the ability for the child to attach is also compromised in many different ways. It can be that if over time, for instance, if there's a mom who's in a severe depression and she is unable to attend to her child when her child is crying for long periods of time or for long stretches of time, that child will stop over time, will stop trying to get the care that it needs. Essentially, it'll stop trying. It will disengage, and these are in the very more severe cases. So I wouldn't necessarily. The reason why I tread lightly is because most people's symptoms are in to a mild to moderate range, and they're not experiencing these very severe symptoms. Although that can still impact attachment. So that's one of the ways that we have to be careful about to make sure that the mother-child connection is as strong as possible, given their circumstances. For some parents, they can either be really intrusive into their baby's space. That would be the opposite of what I was describing before, where they're kind of disconnected. If they're very anxious and hovering and hypervigilant, I've heard multiple times of moms waking their children up from sleep just to make sure that they're breathing, and as opposed to putting their hand on their belly to make sure that they're breathing or something like that. They get into a panic state and will wake the children up out of sleep. So that's a kind of for lack of a better word, kind of intrusive care. It's coming from a good place, it's coming out of love, but it's also coming from a high level of anxiety. And those sorts of things, if they go unchecked, if mom doesn't get help and there's no kind of supportive intervention, and this continues to happen over and over, then you can kind of imagine how that child develops. If that child's developing in an anxious environment, then then they themselves may be either anxious or withdrawn, depending on how they're coping with it.
So it's really, just with what you're describing. And again, I want to also emphasize, as you did, that this is not about blaming moms or being catastrophic or worst case scenario.
Right.
Just wanted to bring up what can happen in more severe cases that go unchecked.
Yeah.
Yeah.
Yeah. It impacts the mom. And during that time, she's suffering. She does not want to feel that way. She may not know that there's help. She may not know that she doesn't have to feel that way. She may have those same lies that depression tells us all the time, that we're bad mothers and this is just how it is. She doesn't have to feel that way. I'm sort of kind of changing the direction a little bit, but one of the most amazing things about this is how treatable it is.
Yeah.
This is absolutely treatable.
Absolutely treatable. And there's so many things that you can also do to lower the risk factors,
Yeah. Mm-hmm.
So if there is a woman listening and she is resonating with what we're describing and maybe she's struggling, what would be your words of wisdom for her?
Oh, mama, you're not alone. This is not you. It is absolutely not about who you are. This is about what you're going through. And there's nothing that you've done to create this. This is not your fault at all. This is unfortunately common, and you're just not alone in this experience. Although you feel alone and maybe scared and maybe angry, there are lots of other people who feel like you and who have gotten help to feel better. And you can too. You absolutely can feel better with the right help.
So, Kat, what are some of the resources that you recommend for moms or their loved ones? And also, if you want to go ahead and share about the freebie or gift that you have for our listeners.
Sure. So my go-to resources, I have quite a few, but Postpartum Support International is a fantastic website and resource. The website itself is in English, but the whole thing can translate to Spanish with a click of a button, which is just amazing. So you can get information on different kinds of mood changes. There's a whole section there just for dads to understand what's going on for them. And also, by the way, dads can also have a postpartum depression. So there's some information there for dads. There is a section there if you are a therapist and you're listening and you want to get more training on this, they have a whole section for that. They do training as well. They have online support groups in English and in Spanish. And there's a warm line that you can call. You can talk to an expert or talk to a support person. If you're a mom or a dad or a partner, anybody can call in. It's just such a beautiful, comprehensive resource. They have people like me all over the country and all over the world, in fact, who cover specific geographical locations, who take calls, offer support, and get people to resources. So that's primary.
And you also have your podcast.
I do. Yes. Yes, I do have my podcast, which I love doing. And we have been going for almost a year. It's called Mom and Mind. And I interview experts and advocates and real people who want to share their stories about their experience and what it was like for them and how they got through it. So it's a really diverse and rich resource. We do also cover some different cultural understandings of perinatal mood and anxiety disorders, and just talk with some people who are at the forefront of changing legislation and getting more protection in the law for moms and just lots of great stuff.
Well, it's a wonderful podcast and a wonderful resource for therapists, for moms, for those who love them. And I highly recommend that our listeners check it out. Dr. Kat, what's the best way for our listeners to learn more about you and get in touch with you?
Sure. They can go directly to my website, www.drkaeni.com. The podcast is also up on my website, and you can email me at drkaeni@gmail.com, drkaeni. And yeah, I'm pretty open to talking with people, especially if you're hearing this and you are even if you're not anywhere near me at all, I'm in Southern California, if you need help, I will direct you to the person who can either help you or is local to you so that you can get the help that you need.
We will have links to all the resources you mentioned, along with your gift, which is the 5 Truths of New Motherhood, which listeners can go to your website and access that, and we'll have a link to your website in the show notes.
Thank you.
Thank you so much for taking the time today to have this very, very important conversation about maternal mental health. I learned so much and I felt seen in
Aww.
yes, absolutely, in so many things that you've described. And I just am really excited that we can share this conversation with women throughout the world.
Thank you so much.
Take care. I hope you enjoyed today's conversation with Dr. Kat. There was so much good info that it's really hard to select just a few things to highlight. One of the things that grabbed my attention was just how prevalent maternal mental health disorders are. 20% of moms is a significant number. That means that out of 100 women, 20 will experience some form of perinatal mood or anxiety disorder. I also loved how Dr. Kat shared what can make a woman vulnerable to experiencing maternal mental health disorders and what the mom, her partner, family, and friends can do so that these disorders can be prevented, and if not prevented, what can be done so that the mom can get the support she needs and begin to heal. And finally, that maternal mental health disorders are absolutely treatable. There is a lot of support and information for moms, family, loved ones, and therapists to access. Dr. Kat mentioned several, and there will be links in the show notes for those resources. And definitely check out her podcast, Mom and Mind. It's a wealth of information for all things related to maternal mental health. Finally, be sure to check out Dr. Kat's website and sign up for her handout, The 5 Truths of New Motherhood. Again, thank you with all my heart for listening. If you enjoyed the podcast, please share it with a friend. Take good care and see you next time.